your sound is not audible. So my sound, I guess it's audible. Okay. Something more about my intro before going into the session. I'm fortunate enough to have my gurus like Sangal sir, Prashant sir, and Hullur sir, Subbanagowda sir. I'm a disciple of Hubli Ayurveda Mahavidyalaya. So I'm very glad after. Hello?
Yes, sir.
Is it audible?
It is audible, sir. Audible, sir.
Can I start my presentation?
Yes, yes, sir.
Yes, sir.
Okay. So now I am a teacher on behalf of the Ahalya Ayurveda Medical College. But in fact, I'll tell you that my first classes I have took in Hubli Ayurveda Medical College. Before starting my session, I just want to clarify one thing: how many time I'm having, and what question answer session, how much time it will be taking. So do you have my freedom? Yes. Okay. So, and that is what, so I'm very happy to be here, and very warm good afternoon to my dear teachers who are present there and who are hearing me, and my dear students in Hubli Ayurveda Medical College, and other guests, those who are listening my presentation. I'm very happy to be here in this moment. So I am going into my topic. Marma in Bahirparimarjanachikitsa, otherwise Marma therapy in Bahirparimarjanachikitsa, a practical guideline. That is what the topic is allotted to me. So last time also I came there, and then I have taken a practical session. As far as Marma is concerned, Marma therapy normally is not that much mentioned in Ayurvedic aspect. It is mentioned in Shalyatantra aspects, where Bhagna and all is mentioned, Bhagna, Ksheda and all is mentioned. Ayurveda mostly mentioning about the Marma therapy on those aspects. Apart from that, there are very little references about these type of informations are present. So anyway, I am comparing it with Bahirparimarjanachikitsa, whereas Kaya Chikitsakas and Panchakarmajnas will be having a great hold. So we can incorporate Marma therapy inside this. So that is what a practical guideline, and that is my personal experience also, what we are doing in Sushruta Institute of Ayurveda and Ahalya Ayurveda Medical College. I'm giving a light on that, my experience. So coming into my topic, what is Bahirparimarjanachikitsa? We all know that Bahyataha Shuddhikaram Peshajam Bahirspashamaashritya Abhyangaha Swedaha Padekaha Padehaha Parishekaha Unmardanadi Amayan Paramarshati Tat Bahirparimarjana. So we know that Bahi Shuddhi in the sense Ayurveda mainly concentrated upon mainly the Vyadhi is occurring due to the presence of ama inside the body, and that ama, if it is blocking the channels, otherwise vitiating the channels, or creating some trouble to the channels, then there the disease will be happening. Yatra sangha kavaigunya vyadis tatro bhajayate. It can be like Sira, the Adi Pravrti, Sangam, Bimarga Gamanam, like such sort. Because Ayurveda is having a direct, Ayurveda is relying upon the main aspect, such as Rasa Rekta Dhatu, which is giving Jivanam and Pranana karmas. It is very important and vital aspect while we are dealing with the Marma Chikitsa. That is very important. So why this is important and why Marma therapy, how Marma therapy can be incorporated with Bahirparimarjanachikitsa, that is what you are going to see. And here, Bahirparimarjanachikitsa means external application of the Sneha Drivyas or some other drugs for the purpose of clearing the channels inside our body. That is called as Bahirparimarjanachikitsa. It is not washing outside, it is washing from inside, and we are trying to create vasodilatation and pushing of the ama from inside. So that is what the Bahirparimarjanachikitsa, where Abhyanga is a key thing that we all know, and then Sweda is also mentioned, and Pradega is mentioned. Pradega can be included like bandages, lepas, and all. And then Parisheka is also mentioned, where Kayaseka and all can be Dhara, Kayaseka can be included, Shirodhara and all we can include. Unmardanam in the sense, we can, if we are putting pressure and then doing some type of massages, that also can be included. Then in such etc. type of treatments are called as where what you are doing outside the body, where the touch is having very important aspect, that is called as Bahirparimarjanachikitsa. So I'm coming into the next slide. An important part of Ayurveda where used in Purva Karma of Panchakarma is relied upon these type of treatment, and Pradhana Karma of it can be used as Pradhana Karma of the Shamana Chikitsa, where we are making protocols and then we are doing it Kerala type of treatments, Kriya Kramas. We are making one set of treatment, and we all are making, not Kerala only. We all are making one type of treatment where in between Shodhanas are given to the patient in chronic disorders. That is another one where the Bahirparimarjana Chikitsa is wisely used by our acharyas and our senior doctors. It can, we all know that it can enhance the circulation and it can enhance the cardiac output and vasodilatation. And it can improve the cognitive aspect, Indriya aspect of the body and the brain function also. And this is mostly used as a relaxation technique and a stress reliever, because Ayurveda considers swastha, who is having the samagni, and without any samadadu, samadosha, samagnischa, samadadu malakriyaha, prasanna atma indriya malaha swastha ityabhidhyate, where the WHO is also mentioning similar type of the statement, where one person is relieved without any pain or other ailments, he can be called as a swastha. We are Ayurveda people are dealing with prakriti sthapanam or swasthasya samrakshanam. There, this type of treatment, Bahirparimarjanachikitsa, has its own importance. Then Bahirparimarjanachikitsa with the different modalities we are using in Ayurveda. We all know that, I need not explain it. Abhyanga, where the pressure and massage you are utilizing, and periphery, we all know that there are blood vessels. We are making the external surface of the body hot, and by that internal blood vessels will be getting hotter, and it will aid in vasodilatation and it will help in cardiac output. And we Ayurveda people, we will be focusing upon the ama which is present inside the body, that can be channelized towards the koshta. That is main important aspect what we are doing with Abhyanga. Then Patrapotali Sweda, that is a type of Sweda where the massage and the Unmardana type of treatment, where the shaky type of movements we are doing inside on the body, that is also another one. Another type of Potali Svedas are there, like Churna Pinda Sveda and the Shashti Shalipinda Sveda. They all are, even though they all are using for different modalities and purposes, but what we are doing is we are doing Unmardana Kriya and Abhyanga Kriya only. We are utilizing there, and that is for the purpose of Svedana. So this is also coming under the Bahirparimarjanachikitsa. Why I am telling all these things means later on I will be dealing the similar aspect where the Marma therapy can be incorporated with all these things. Here Pichu and Lepas are mentioned. So different type of, in different areas we are utilizing, where the Sneha Dravya or some other Dravyas we will be keeping, and then we are trying to make the body hot. That is also very important. And Udvartana, where the pressure and massages are wisely used, where it is a dry massage, where the Sneha Dravyas are not at all used, but the pressure obviously used. It is also the making the body devoid of Snehana. We are utilizing Udvartana. So it will come like Abhyanga, Parisheka, Pichu, Lepa, Pradeha, Potali Sveda, Udvartana, Avagaha, Murdhini Taila, Anjana, Tarpana, Snehanasya, Samvahana, everything can be considered as Sthanika Chikitsa or Bahirparimarjana Chikitsa, we can call. And as we all know, I am not going into the Marma's number, name and all in too much details. But for the importance of the topic, I have to be specific for the I know with my topic. I know that all of you are well versed with all these things, but if somebody doesn't know, they have to make a refresh their knowledge. So we know that 107 numbers are there. Some of the acharyas, they are having difference of opinion. Even Tamil system, Siddha system of medicine, what we are into today, they are having difference of opinion. I'm not going into the difference of opinion aspect and all. I'm focusing upon the direct practical aspects only. So Marmas in generally, we are telling that vital spots which are having vital energy. So it is an important sthana of prana vayu. Charakacharya has mentioned that there are the marmas inside our body, particularly in Trimarmiya Chikitsa. He was mentioning that three marma, that is the Basti, Hridayam and Shiras, where the prana resides, and those areas, if at all getting affected by the doshas, then the patient will be having different type of pranopaghataka type of diseases like Mutrakrishra, Mutrakhada, Udavarta type of diseases. It for hearing it will be very simple. It will be like symptoms, but if it is not treated properly, it will be killing the persons. That is very important. And it is of 5 types, and how it is affecting the body and all we will be dealing. Later, the Mamsa Marma, Sira Marma, Snayu Marma, Sandhi Marma, those types are there. Because what are all our 7 dhatus? Among them, those things which are present inside, that will be formed as Marma. That I'll be coming into the later aspect. Among Marma Vidha is considered as, these vital points are considered as very dangerous. And 3 marmas are highlighted by our acharyas, and Nabi considered as the main seat of pranavata, which is helping us to thrive. Nabistaha pranapavanaha sprishta hritkamalandaram kandat behirvinyadi padum vishnu padamardam pitvaja ambara piyusham punaraya divegataha prinayan dekamakilam jivayan jadranallam, where the metabolic aspect is starting from the Nabhi, and it is going into the throat, and it is making Jivana and Prinana aspect of the aspect of Dhatu functions all over the body. Without that, we can't thrive. That is very important. And this vital energy is can be otherwise called as the Siras. Sorry, Ojas. Then comes about Marma therapy. Marma therapy almost dealt in Shalyatantra point, and particularly in Siravida concept, where in Ayurvedic aspect, where and all we should not cut. That is very important. And if at all you are getting a cut or wounded, then what to do? That aspect it is mentioned, but our acharyas are not the pointly mentioning that this is a marma and this type of treatment should be done. It is not like that, but they have they are as per the tantra yukti aspect, and once they are explaining it, and once again they will not be focusing into that may be the reason they didn't explain it. And so marma sharira, there is a perfect description of marmas, but the treatment aspect it is scattered. So Siddha system of medicine, particularly in Kalari and Adimurai type of native martial art techniques, they are using this type of marma therapy, and where a teacher will be there, he will be teaching the martial arts to the kids. At that time, one second. Sorry, I had a visitor. Yeah, sorry. So, in ancient war fields, marma points are effectively covered with armors. For that aspect only, that is also their first concern why the marmas are mentioned for the Rajavaidyas. And here in the battlefield of Kalari training session, the students used to get afflicted with the marma khadas. Because of that, every time they cannot be, they should not, they are not able to send the students to the hospitals or nearby Vaidyas. So the teacher must understand the marma and he have to treat faster. So for Atiga purpose only, these Kalari type of the treatment modalities were mentioned. That is called as marma therapy. And Sadhya pranahara marmas and Kalanantara pranahara marmas are given prior importance to hide behind the armor. Armor के पीछे ऐसा हाइड करके हम रख सकते हैं, ऐसा करके ही वो इम्पोर्टेंस दिया है. So, and now we are going into prana and prana or vital energy and ojas and siras. In Ashtanga Sangraha, in Sira Shariram, it is mentioned prana or vital energy is moving with ojas in the siras, where the dhamanis and siras can be called as siras only, and they are the prime channels which is carrying rasa and rekta all around the body. That is what Ashtanga Sangraha is mentioned. All the acharyas are also opening the same. And if any type of obstruction is causing in anywhere, it will stop supplying ojas in the in that site. It may not be able to supply ojas in that site, and the rasa rekta will not be going there. There the tissues may die. That is what the statement is given. And all the marmas are given in relation with the srodas and siras, where the marma therapy healers are putting effort to keep prakriti stapana of siras and anatomical position. So now we would have been understand that what the marma people are doing, they are simply stimulating the blood vessels behind the skin. So while I'm going into the practical videos there, so at the time you will be understanding what the relation means. I was not able to take a lot of videos from them. I have selectively taken some of the videos because otherwise the session will be very lengthy. And one more thing is these Marma healers or Marma therapy people, they are having a particularity that they should be trained under a proper martial art, Kalari martial art trainer for 12 years. Then only the previous guru will be giving will be passing the information about the marmas and their treatment aspect to the next disciple. He is going to be a guru and making another one Kalari. Kalari means the martial arts place. So that he can save his students. That is what the purpose is. And particularly, yeah. Our Acharyas, Ayurveda and Marma therapy. Our Acharya has given elaborate description about Marma, Marma Shariram, and Ayurveda. The Ayurveda also believes that prana or vital energy is residing in all the marmas, and Ayurveda explains Bahirparimarjanachikitsa and interruptions are beneficial for the common ailments of marma affliction. Trimarmiya chikitsa, we can find out Abhyanga and Pathophysiology and all. It is mentioned there. And Shastra Karma, Agni Karma, and Kshara Karma, Kshara Vidhi. In practical performance, Marma is given utmost importance, that I have already told. From the 107 Marmas, it is mentioned that Mamsa Marma, Sira Marma, Snayu Marma, Asti Marma, and Sandhi Marma are there, where it is inside our body parts. It is divided into 5 types. The types of marmas as per its importance: Sadhyo Pranaharam, Kalantara Pranaharam, Vishalyagnam, Vaikalyakaram, and Rujakaram. It is mentioned by our Acharyas, where Sadhyo Pranaharam means immediately the patient will die, and Kalantara Pranaharam means later on the patient can die, 1 month, 2 months aspect. Vishalyagna Marma means once the Marma is, once the Shalya is entered inside, if we are taking the Shalya out, then the patient will die. Vaikalyakara Marma means the patient will be lame after the affliction. Rujakara Marma means only for causing pain. These things are properly utilized by our land fighting army people while they are dealing with the enemies. So for the purpose of affliction of the body, the Kalari people are utilizing these type of marmas. So once if the opponent has pressed on particular area or afflicted on particular area, those the physicians or those the marma healers, they are having ability to give marudat. It is called as marudat in Tamil aspect, where they can give a pressure against that affliction on the other side of the body or in other parts where it is mentioned. If you are seeing Bahirparimarjanachikitsa in a short, the modalities are used for cleansing the sodas from vitiated dhatus and doshas. That is what Bahirparimarjanachikitsa usually do. Mostly used in Svedana modality, increased vasodilatation and cleansing of ama to the malayanas is the main aspect. Patra Podali Sweda Abhyanga is wisely used for Nishpidana of Rasayanis to direct ama from malayanas. And Snehana is a common factor that which is used for the procedure. Then Abhyanga and Svedana is the key process therapies which is used. Unmardana is also will be used in the it is used in Marma therapy also and in Ayurveda also. Kalari system of medicine, Siddha system of medicine is practicing it very well. Then comes the practical considerations. And we all know that ama is causing srodoroda, and how it causes and all. Once again, I need not explain. Once ama is causing srodoroda, then arteries and the veins, if at all it is blocked, then what will be the symptoms which we are expected to have? That is stroke, fatigue, dizziness, shortness of breath, chest pain, lower back pain, erectile dysfunction, painful or numbness or cold hands and feet. It is a large set of symptoms which is explained here. Those things, because of the circulatory failure, these can happen. Once again, I'm telling to my fellow people, those who are sitting there and listening me, we all are dealing only these things, not apart from these things, anything we are not dealing. So this is, where the one artery in the hand is affected. When the carotid artery is blocked, the brain is affected, and you can see that. And these are all some examples. So small piece of clot can in the carotid artery affecting the brain, different areas, and varicosities can make varicose ulcers. So that is also another thing. And the arteries or veins serving to the eyes, if it is getting blocked, it can cause andhyatvam. And these are all the things. And in heart, if it is blocking, heart attack can be happening. So, and these are all the things. What are all the scope? During the Abhyanga, among 7 steps where we can incorporate this Marma type of therapy, that is very important. It is actually, before that, I will tell you that what is Marma therapy in proper. The physician, he will be applying a pressure with his thumb on the particular Marma point, and he will be squeezing or pressing or releasing. These things only he is doing there, and stimulating the arteries. That is what he is doing. So where we can have the scope of this, where the Abhyanga, we are having 7 postures. 7 postures, one step is repeating twice. That is supine posture. While we are lying down, first as the 7th step, supine and sitting postures are coming, coming as the 2 steps, which is repeatedly coming. So on that one step, we can use this Marma therapy that you are going to see in the next slides. And how it can be helpful? It can be helpful to the Prakriti Sthapana of the Srodasas and the particular area where the Rasa, Rekta and Ojas was not supplied. That will be the added effect of that. And instant Rujahara aspect we can hire from it, because with the Ayurvedic aspect, obviously we know that we all are experiencing. Some of the delay, some or the other way of the delay will be there in getting Rujahara aspect. But thing is, Ayurveda is very good in treating aspect. I'm not having any doubt. But Atika chikitsas, we are not dealing. That is what we are a bit far. Here with this therapy, we can do the Atika chikitsa also. That is very important. Then sandhis are the main reason for mobility. If you are studying the Marma therapy, you can do easily traction of the sandhis and keep it as normal, in normal position. And deep massages can take out sangas in the siras, and which is causing the roga. Deep massaging twisting causes defragmentation of obstructed particles which is present inside the siras, and we can mobilize it. Pressing for 30 seconds or so can cause sudden arrest of the flow and filling. Can act as a pushing force, which while the heart is pushing. So that is very important. Where the Marma therapy, the therapists are unbiased. What is meant by that? While doing massage, he only knows the Marma therapy, where the joints should be normalized or vital energy should be normalized, and he knows only one thing. He's like a horse who is which is kept its eyes closed, like straightened. So so he is unbiased and he doesn't know the modern concept and the threat also. So he is fearlessly doing the treatment. So that is what one thing. Because as Ayurveda people nowadays, we have studied the modern things also. Then we'll be so much of thinking about the consequences more than the effects. So we'll not be doing the work in Atyeka chikitsas, but they do it. That is what I found. Do the support what they need for the moment and to save the student. Support with the fracture and management and dislocation management. This therapy is I have already told that 12 years of Kalari things. At least 3 years of Kalari is also very essential if at all you are performing that. Anatomical defect caused by and accidents, lifestyle disorders can be managed with the traction methods what they are using. No instruments are needed except cloth and physical assistance only needed. So that makes easy. We need not have a traction table and all. The patient will be more happy if the physician is interacting with them in a physical way. Then comes how we are doing it and options. How we are doing it. Okay, everybody will be eager that what Dr. Krishna is telling. He's telling something in the afternoon hours when we are sleepy, and the pressing Marma therapy and all he's telling. Before going into the details, I'll be telling the cautions first. What they'll be telling that you should not press. That is very important. Next video is showing that. So I will be telling that these people may not be knowing English and all. They may be knowing Malayalam and Tamil language. So I have went to a physician named Sibi Vaidyan, who is well versed in such type of therapies. And then I have shooted the things for you people. I thought that it will be benefited. What we are using here, I thought that from the healer directly, if you are getting that, will be more good. So the cautions are okay. The healer is actually telling that he is using the thumb only he is using, unlike Ayurvedic massage where we are using the whole palm on the body. So that is very important, and it is almost similar, but the techniques are different, where you will be focused and pushing on the particular side and squeezing it down. So that is what. Okay. Okay.
അത് മസാജിന്റെ ഒരു വേറൊരു സിസ്റ്റം തന്നെയാണ്. പക്ഷെ ഇതിന് വിരൽ മാത്രം യൂസ് ചെയ്യുന്നു എന്നുള്ള ഒരൊറ്റ പ്രത്യേകതയുള്ളൂ.
പരമാവധി കുറച്ചാണ് ആ മർമ്മങ്ങളിൽ ഉപയോഗിച്ചുകൊണ്ടിരിക്കുന്നത്. While he is pushing, he should be very cautious that the marma should not be afflicted too much. That is Vrihi Pramanam and rice, paddy rice, that much pressure only he have to keep. Those things are there in the while you are doing pressure. That is very important. But thing is, while we are doing our treatment, slight pressure we can use it, no problem. Anyway, we are doing the treatment.
Right. അതെ. പിന്നെ ഇതിനകത്ത് മർമ്മം എന്ന് പറയുന്നത് എല്ലാം ഇങ്ങോട്ട് തിരിഞ്ഞു മാറും. ഇത് മർമ്മം എന്ന് പറയുന്നത് എല്ലാം തന്നെ മർമ്മങ്ങളാണ്.
അതെ, എവിടെ വെച്ച് കഴിഞ്ഞാൽ പണി കിട്ടും,
എവിടെ വെച്ചാലും പഠിക്കും. അറിയത്തില്ലാത്ത ആളുകൾ പിന്നെ ഇതുപോലത്തെ ഈ ചുഴികള്, ഇത് കണ്ട ഈ ചുഴികള്, ഈ പോയിന്റുകൾ.
See the reaction of the patient while he is pressing the marma.
ഇങ്ങോട്ട് തിരിഞ്ഞു മാറും.
Okay.
ഇത്
അതിനകത്ത് പ്രസ് ചെയ്തൂടെ അല്ലേ?
ചെയ്യാൻ പാടില്ല.
മസാജ് നടത്തുമ്പോൾ
ഇവിടെ വരാൻ പാടില്ല.
അതൊക്കെ പെയിൻഫുൾ ആയിട്ടുള്ള മർമ്മങ്ങളാണ്. അഥവാ if at all you are pressed, then you have to use like this maradat, where only the Kalari practitioner will be doing it. He is a person who is practicing Kalari aspects since 18 years. He has studied. He is since 40 years, but he has studied from the childhood up to 18 years. He have studied. So this is a caution. While you are pressing, you should not push too much. If you have pressed, then this is the mardata what he is using. That length is very important, and the push is also very important. While you are doing it on the spine, you have to use it, and from the opposite side also you have to push. That is very important, because of if you have pushed and the pressed the spine too much, then the patient can be afflicted. ഇനി എനിക്ക് എന്തെങ്കിലും പഠിക്കണമെന്ന് പറയണോ? So after that he have to turn side by side if the masseur unknowingly pressed on the particular side. Techniques what we need to follow, and Ayurveda and contemporary knowledge, that is also very important. And in Siddha system of medicine, it is there are 5 types mainly. There are 5 types mainly. That is called as Padumarmam, Todumarmam, Nokumarmam, Tattumarmam, Putumarmam. These are all the 5 types. And there are other types of marmas are also there. Padumarma means Satyapranara only. Todumarma means by the touch itself, the patient will be getting pain. That may be called as Rujagara Marma. And Nokumarma is you can control by the sight of the Kalari martial art people itself. The opponent will be getting controlled. That is called as Nokumarma. Then Chundumarma is by using the finger he can control the enemy. And Tattumarma is once you are afflicting the opponent and you want to save him, then the remedies should be done on those marmas. And then Putu marma is also there, where you are tying up the enemy with your own hand. So that is what I found out. So as per Ayurveda, Satyapranara marma will be there. That is 19 in number, Agneya in type. Within 7 days, the patient will die. Kalandra Pranara marma 33 in type. Saumya and Agneya in nature. And 15 days or within 1 month, the patient will die. Vishalyagna Pranara marma, that whenever the Shalya is there inside, till then the patient will be living. And Vaigalyara Pranara marma, that is 44 in number. So that it can cause only the Vaikalya, and Rujagara is Agni Vayu in type. It can make pain. So Satyapranara marma, you know that Sringadaga, Adipati, Shankha, Kandashira, and Guda, Hridaya, Basti, Nabhi, and all. it is there. Kalandra Pranahara, Abastambam, Talahrita. I'm not going into these details because you already know that Vaikaliagara Pranarma, Uksheba 2 and Stapani 1. Vaikaliagara Pranagara Marmas, the Ani and all, it is there. Gulfa, Manibandha, Rujagara Marmas, and Kurcha, Shira. You may not be interested in such things. I am telling that. Now we'll go for the marmas which is pertaining to the head. That is very important. There are several marmas. You can see that the arteries and veins are going through this way, and even external aspect, if you are pushing, you don't think that it is safe. If at all your push or affliction is more, then the patient will be getting trouble. Otherwise, the opponent will be getting trouble. So in marmas of the neck also, there are several arteries and veins, nerves and all is passing through that way. So once again, if at all injury to the neck or head, if it is causing, then what will be the technique which is used by the marma therapist? This is a type of the technique which can be used as artiga chikitsa, where if the patient is in coma or murcha avastha, if patient is the behoshe and he is not able to regain his consciousness after the affliction, he is lying down. What you have to do is you have to do an abdominal massage. How he is using his hands, you have to just check it out. He is pressing with his thumb around the navel, and then he is pushing into the perineum. Then from the area where he started, he is pushing into the hands. Then he is coming through the chest and taking into his neck, and he is pushing this side, and he is using there, after cracking sound only we have to leave the patient. Lying position only you have to do it. And if at all you are not well versed and patient is unconscious and you are the only one who have to save, then you can use the towel. From behind the occiput area you have to catch. You should not press on the chin too much because that can strangulate him. There you have to keep support. Then we have to tell him to inhale and exhale. Then 3 times you have to stretch. Then stretch. While lying position only you have to do it. So normally these can also be done in cervical spondylosis and cervical spondylitis, the conditions where the structural deformities are present. The patient can be saved because of this traction method what they are utilizing. I directly witnessed it, so I guess they may be right. After this procedure you have to do an oil massage all over the body, and then you have to save the patient. Oh, sorry. Hello, is it audible?
Yes, sir, it is audible, sir.
Oh, I'm sorry. 1 second. I got stuck with some.
ഇത് ഓർക്കകാലമാണ്.
Okay.
ഇവിടെ കൊണ്ടുവന്നാൽ ഇത് ഓർക്കകാലമാണ്. അത് പതുക്കെ ഓർക്കും.
Okay.
ഇതും പിടലിക്കാലമാണ്. ഇവിടെ കൊടുക്കുന്നത്.
They're telling that these areas where the arteries are going. So I have shown you the photographs before. One second. The arteries and veins which are going on the neck, and where the muscles are also there. And for your kind information, that all the Sira, Snayu, Sandhi, Asti, these 5 things, if it is passing in one area and if it is present in one area, that area is Sadhya Pranaharam. And any 1 or 2 or 3, that can be like a Kalandra Pranaharam. Once again, you go and read follow the classics. They are mentioned there. So what he is telling, that they are here, 1-2 arteries are going. If you are pressing on the artery aspect where the carotid artery is there, that is called as Uraka Kalam, where it can cause sleep. So once again, if you want to if you want somebody to sleep, you have to press there where the brain arterial supply will be closed. So that is one thing. And the next by the jugular veins are coming. If you are pressing on that and stimulating, that will be very good for the neck problems. That is called as Marma. Okay.
ഇവിടെ ഒരു കുറിപ്പിട്ട നേരത്തിൽ ഇത് പിടലിക്കാലത്തിൽ ഒരു ടൈപ്പ് അല്ല. പിടലിക്കാലത്തിൽ തന്നെ പല മുറകൾ നമുക്ക് ചെയ്യാൻ സാധിക്കും. അതായത് ബേക്കിലെത്തിയാൽ നമ്മുടെ സുഷുമ്ന നാഡി എന്ന് പറയുന്നത്.
While you are treating with the cervical spondylosis aspect and all, while you are treating that, at the time you can use different type of modalities, but make sure that you are very careful about those stuffs while using these procedures, because neck is a very important point where the sushmina, the spinal cord is passing. And if it is getting cut or something, it will create a lot of problems. So one should make sure that there is no fracture of the vertebra and all. So that is very important.
നമ്മുടെ സുഷുമ്ന നാഡി എന്ന് പറയുന്നത് ഇതിലെയാണ്. ഇതിന് ഇടയിൽ ഇതും പിടലി.
Hello.
Yes, sir.
One second, my PowerPoint has failed. One second. Some problem with the. Okay. One second. 1 second. Some problem with my computer.
Okay, sir.
Sorry for the inconvenience.
We'll wait, sir.
I think it is getting stuck. Sometimes the connection may be cut. So I think I have to restart it or something. It's not working. Hello?
Yes, sir.
Is it audible?
Yes, sir.
Can you see my screen?
Yes, sir.
1 second. It's not working. I will re-enter, it seems. 1 second. I'm stopping sharing.
Yes, sir.
Yeah, I have
Sorry for the inconvenience, participants. Please stay with us. There is some technical issues. We will resume back. Sorry for the inconvenience. Participants, there is some technical error. We will connect soon.
Sorry friends, lot of problem here. So I was not able to manage it. Internet went off and my computer hanged down. Hello, is it here? Audible?
Sir, it is
Hello?
audible, sir. Audible, sir.
Straight away, I'll share my screen. Madam, can you enable my screen sharing aspect? Hello?
Now you can share your screen, sir. Sir, you can share your screen, sir.
No, it's okay. Because of larger videos, maybe my computer got hanged.
രണ്ട് സൈഡിലും പ്രതീകാല വർമ്മം എന്ന് പറയുന്നത് ഇത് ഓർക്കകാലമാണ്.
Okay. Okay. Now is it? So
രണ്ട് സൈഡിലും പ്രതീകാല
this is actually a marma for the neck joint injury. So where these two marmas are very important.
Okay. ഇതും പ്രതീകാലമാണ്. ഇവിടെ കൊടുക്കുന്നത് പ്രതീകാലമാണ്. ഇത് പ്രതീകാല വർമ്മം. ഇവിടെ ഒരു
He is just demonstrating. We should not do like that.
പ്രതീകാലത്തിൽ തന്നെ പല മുറകൾ നമുക്ക് ചെയ്യാൻ സാധിക്കും. അതായത് ദയക്കിലെത്തിയാൽ നമ്മുടെ സുഷുമ്ന നാഡി എന്ന് പറയുന്നത് ഇതിലാണ് ഓട്ടം. അതെ അല്ലെ? നമ്മുടെ സുഷുമ്ന നമ്മള് ഇങ്ങനെ കൊടുത്തു കിടന്നാലും ഈ മുറ എന്ന് പറയുന്നത് ഒരിച്ചിരി റിസ്ക് ഉള്ള കേസാണ്. കഴുത്തിന് സംഭവിക്കുന്ന ഏത് കാര്യവും ഇളക്കുന്ന കാര്യം വളരെ റിസ്ക്കാണ്. റിസ്കി എന്ന് പറഞ്ഞാൽ ഒന്ന് ഉച്ചയോർമ്മം, രണ്ട് ഉള്ളതാണ്.
So before what he have done, that stretching aspect we have to do. Apart from the massaging aspects they are performing, what we have to do is we have to touch we have to do like this three times tapping on the forehead and on the sole also we have to tap. That can be with this force only we have to use very fast. You can use by the hand also or with the leg also you can use it. While supine posture you can use this type of the aspect. So these three techniques are utilized there. First, after massage, you have to stretch your the neck, and then afterwards you have to tap on the foot and on the above the head also you have to tap. So these are all the techniques for the neck injuries. So almost for every marma khada, this three times tapping on the head and 3 times tapping on the sole, that is vital for the people. The marma khada will be rectified. That is what the explanation is. Next is for the low back area, which is very common. I'm not going into too much of details. So for the low back area, the internet connection is having a trouble. So He's telling that there are several segments on the low back area. He asked that what we are doing. I told that we will be using physiotherapeutic aspect as a support for the traction aspect, and he's telling that there are the several segments like vertebrae are there. So by the two sides, Sushmina is giving its branches. We know that there are dermatons which are present on all over our body. So we have to undress the patient up to the sacral area, and we have to insert our finger to the anus, and then we have to catch. Actually, it's a demonstrative session, so he didn't catch him because of thread. Actually, we can catch the sacrum by the two fingers. After inserting a finger inside the anus, you can use the gloves also, and another one person have to hold the neck, and then these two people have to do traction, where the patient have to stretch his legs apart so that the physician will be getting easy way to catch the student is getting a fault or having any disc problems, they are utilizing these type of techniques. So we can also use that while the patient is in the prone position. So he's telling that even though the spine is fractured, it can be healed, and if the patient is getting numbness on the bilateral lower limb, and the patient is not able to feel his lower limb, in such condition also, as Atega chikitsa, you can do that. If you are doing it, then the spinal cord injury may not be happening. That is what they are claiming. But for the fall and all, you are doing this type of treatment. I'm not sure about that because I'm also not doing it. But this type of treatment, what we are doing is for the spondylolisthesis type of the diseases, we are using that. Next comes knee joint. For the knee joint arthritic aspect, it is very common, and knee joint pain is very common. So there are two techniques are there. One technique is used on the knee joint, and another technique is used on the chin. It should be simultaneously synchronized. So here you can see what are all the anatomical aspects. Once again, I need not tell you that all learned scholars are sitting there. So you can see that the Marma therapist is utilizing a particular area for pressure that later on, once again, I'll be showing this anatomical part for you so that you can understand that he is pressing on the Siras where the artery and vein and a nerve he is stimulating. You can see that, and that particular type of technique can be utilized in all the Marmas. That's what he told. See how he is keeping his finger. That is very important. even operation can be, avoided in the initial stages, he's telling. So you have to push and stabilize it. So severe pain that which is having in the knee joint can be rectified. You can push it where the two arteries are going. So up to bearable aspects you have to press, and clockwise and anti-clockwise you have to twist. So three times, 2 times you have to repeat. Okay. First he has used in the lateral side. Now he is coming into the middle aspect where the artery is running. There he is pushing. The patient is having pain. He told that 30 matra we have to count. There, I guess he is stopping the blood pressure. He is pressurizing the artery, and then he is releasing it. Then he is going for the tip of the popliteal fossa. Okay. He is pressing that. There another one marma is there. He is pushing there, and then twisting it. There are all the 3 structures: nerve, artery, and vein. These 3 are passing through, and the mamsa marma is also there. So, and sandhi marma is also there. 30 times we have to 30 count we have to keep, and then you have to release. The patient will not be having much pain. If at all the patient is having pain, after that we have to do for Mar that 3 times on the tap on the head and tap on the lower aspect. These 2 areas should be pressed and released. While the patient is on prone position, you can ask the masseur to stop, and then you can perform this action. Okay. There you have to use 4 angular measurement, and on the muscular deviation aspect where the popliteal fossa is starting, there you have to use, and whenever you are stimulating the marma, you have to utilize your tip of the finger. That is important, and he is using knuckle push-ups and all, not knuckle finger push-ups and all. So because of that, his hand is very very hard and hold out. His hold is also very, very perfect. But the force is actually normal. You can use by yourself, and then see his finger. How he is keeping. It is having a curvature. So if such fingers with the hardness can have a good hold on the marma point and on the areas what he was telling. And soon after that procedure, we have to proceed to this procedure. He is telling that majja can be more, you'll be getting better majja while pressing here. That is also another one thing, because I can't relate it with the logics, but he is telling that once if we are initiated that marma point, we have to push this. Normally, there one one nerve is coming, that one nerve's ending is there. There you're pressing. 30 matra you have to press and then release.
Okay.
Once in a day, one time in a day only you have to use. Another one marma is also there. That marma, if you are stimulating and then giving eye exercise, that will be better for the eye vision. Sight is also will be better. But for the knee joint, this is the marma point which should be stimulated. And another one marma point, and this is the last marma point what I'm dealing, because lot other marma points also he has told, but there is lack of time for us once again. See, arteries and veins are coming through this way. If you have to give a good pressure over that area. So we'll move into the hip joint and low back area. You have seen the pictures. Okay. Slowly you have to spread your hand 9 times or 7 times, up to your yukti you can utilize it. From the Muladhara chakra you have to push. Then you have to massage on the head, on the hand, and then once again you massage there like this 9 times or 7 times. Then you have to next opposite leg you have to massage. Okay. So just like that, opposite hand and leg should be activated. So if the patient is having more time, then you can utilize more, like this twist. It will be better. Like 9 times up to maximum you can utilize. You can use it. It is very tedious job for the therapist for doing it. But normally they are activating the Ida Pingala concept there, where the sciatic nerves are getting benefited. That we can understand. And the blood vessels will be getting drained. Here he is using spine activation methods. So there you have to use your hand in between the lamina. So he's telling that till sacrum we have to use. So by this side you have to use. By the side of the lamina you have to use pressure. Spinous process you have to use the pressure, and then you have to stretch it down till if anywhere they are getting severe pain or grabbing type of pain. Then as in the screen it is there, you have to follow the area of hip.
കഴിവ് വരുന്നതുകൊണ്ട് തന്നെ ഈ ഒരു രീതി താഴേക്ക് കൊണ്ടുവരുമ്പോൾ ഈ ഒരു പൊസിഷനിൽ എത്തിയാൽ നമ്മുടെ ഈ വാരിക്കും ഇതിനും ഇടയിൽ നമ്മളുടെ കൈവറിൽ എത്തുന്ന സമയത്ത് ഈ കൈവറിൽ ശരിക്കും അങ്ങോട്ടും ഇങ്ങോട്ടും റൊട്ടേഷൻ ആവുകയാണ് ചെയ്യുന്നത്.
എങ്ങനെ ഇവിടുന്ന് വന്നിട്ട് ഇങ്ങനെ അങ്ങോട്ട് പോകണം അല്ല,
ഇവിടുന്ന് കൊണ്ടുവരുന്നു.
He's telling that once again, while you're massaging, your hands should be on that side where you can sidewise you can shift it, where your finger should have a pressure, the other areas you should not push. So that is very important. So this is what the methods which they are following for the spinal aspect, where the traction is also they are utilizing what we have seen for the neck aspect, what we have seen. The same technique is also utilized for the spinal aspects. So this is the presentation, and in chronic diseases also you can utilize, not in Anatomical chikitsa, but as far as our position is there now, we are getting a lot of chronic diseases where Srodharoda is present. You are suspecting that you can also incorporate this with this method also. But only the thing is, those patients who are having Bahudosha Avastha and not able to do Shodhana, then if he can tolerate pain, he can utilize this. And for the Bala and Vriddha and Sukumara Nari, you have to avoid. The patient will get confidence if you are doing such type of treatment. That's all about the presentation. Now the presentation is open for discussion. Thank you.
Thank you, sir.
Yeah.
So here are some questions asked by the participants. With your permission, can I go ahead, sir?
Yes, yes.
Sir, how does a Marma therapy helps in congenital anomalies and genetic disorders?
It will not help. It will not help because as for the therapy what he has explained, and what we are seeing with our logic also, and our science what it is telling, and with the modern scientific aspect also, congenital anomalies, structural damage will be there. That structural damage cannot be rectified. Once the too much of destruction is there for a structure, it cannot be rectified. But 10 patients from 100 patients, they'll be coming with congenital anomaly. But all the other 90 patients, they'll be coming with such type of diseases to the Ayurvedic people. So congenital anomalies may not be able to, I fear, may not be able to cure. And in fact, this Vaidya is having a cancer.
Thank you, sir. Next question is the time duration which is explained during the types of Marma. So like 7 days in all. How evidence they are, sir? Like why only 7 days, and on what basis the duration being explained?
I guess because of the bleeding. If it is being cut, because of the bleeding, how much quantity of the blood is drained from there, or how much the area is getting blocked, accordingly only the main vessels, if it is on the head, if it is getting blocked, sadhya prana haram, so that is there. If it is if one person is cutting his manibandha, radial artery, then he'll this some time it will take to die. So
Yes, sir.
that aspect only they are telling, I guess.
Yes, sir. Thank you, sir. Next question is, sir, we would like to know the mechanism behind the navel pressure in coma patients, sir, which you have explained this.
Yeah, one second for that. For that, I need to show you something that which is that which is I felt relevant, so I missed it in the presentation.
Yes, sir.
So I was also doing my PhD aspects. So you know, it is a pressure for me,
Yes.
because my
Yes.
teachers have told me to present. So once
Yes, sir.
again, I spared my time.
We are very glad for that, sir.
Yes, because once teacher, every time I used to tell that, yes, sir, I'll be doing it.
Yes, sir.
So that was my uh, that's how I was there in Hubli. Oh, you're offline. Okay, one second. Some problem with my internet connection is also there.
Sorry, Andhra.
And and one second. And because of my presentation, lot of space has a pain and dermatomes. One second. Some internet problems are there. One second. I will be. Yeah. Any other questions? Do you have any other questions, please? This question
Yes,
will
sir.
come to
Yes,
this.
sir. Yes, sir. Like, how does Marma therapy helps in GIT disorders, sir?
Yeah. Actually, Marma therapy can have a good support on GIT disorders. Their Nabhi Marma activation is very good. They are telling that on the Nabhi and above the Nabhi, below the Nabhi, two Marmas are there. There you are pressurizing, and then like these three massages are if you are utilizing it, what will be happening is the, that there you have to use a deep pressure. He has also explained that, but I'm not able to show the video because of the internet. Their inferior mesenteric and superior mesenteric vein, which is passing through the passing to the you know passing to the portal vein. There, if we are making some such type of movements, it can have an effect on the the portal vein, which is continuously collecting uh, the blood from the intestines. Actually, the intestinal blood the superior mesenteric artery and superior mesenteric vein and inferior mesenteric vein, which is draining the blood from the intestine to the portal vein, and the portal vein draining into the liver and to the inferior vena cava to the heart. This is the way of metabolic aspect which is spreading. Actually, after digestion, the juice of the after digestion, that which is going through this way only. So if we are pushing that area and making channelize, it will make draining of the blood more into the intestines. Sorry, no, not intestine, into the portal veins, and it can have digestive secretions more, where the pancreas is there, and the movement there, that which is happening, can stimulate the gallbladder and juice, that is bile juice, and pancreatic juice, which is alkali, and gastric juice is also there, and arteries are celiac arteries supplying there. So once again, actually, if we can increase the circulation there, obviously the functions of the that particular area uh, can be better. So here you can see I'm showing the dermatomes of the low back area. What was the question which you have you have asked before?
Sir,
Hello?
mechanism, yes, sir. Mechanism behind the navel pressure in a coma patients.
Yes. You can see here either, below the navel area. Are you seeing it? Is it visualized properly?
Yes, sir. Yes, sir. We can see, sir.
Yeah. T10. T10. He has put his pressure from this area to this area. Like this only. He has kept his pressure, and then he's pushing down. What is happening is, if we are pushing a lot down, it will generate severe pain stimulus, and because of that pain stimulus, the patient may awake. Because normally a patient is not coma patient, like he is telling coma patient, but we can understand that it is unconscious patient. So if we are putting the pain sensation, it can help. That may be the logics what they are utilizing. Rujagara marmas they are utilizing. That may be the reason. And not only this, another thing is also there. Some of the thylas are used and some nasyas are used in coma patients. Those who are unconscious, Siddha system of medicine, they are utilizing some churnas, that is the Avapidaka nasya and Churna nasya, and all they are utilizing. Some of the herbs they'll be utilizing on the nostrils for making the patient to get awake. These are all the Marma techniques which can be utilized for our day-to-day activities, what I have told. But some other things are also there. But Ayurveda is having our own benefit. We need not go for the other aspect. Churna nasyas you can utilize. Pain stimulation only. Rujagara Marma. Is that over? Hello?
Yes, sir.
Is that over? Question?
Yes, sir. Yes, sir. Thank you, sir.
Okay. Thank you very much.
Thank you for the informative session, sir. Now I call Dr. Smita for vote of thanks, sir. Thank you so much, sir. The session was very informative and it was very enlightening on the Marma topic, sir. And we also thank on the behalf of Panchakarmiya Tattva Prakashana 2020 for your valuable time in this pandemic crisis, sir. We were very happy to have you with us, sir. Thank you so much, sir.
Thank you very much. Thank you.
Thank you, sir.
Yes,
We
sir.
are ending the session here.
Yeah.
Participants, tomorrow will meet for the another informative session at 11 o'clock. We'll end the session here. Thank you all.
Thank you.
Thank you, sir.